Why are teeth crooked? It's genetic, of course, isn't it? Intrinsically, we know this, so no one questions it. But science is about questioning things. And questioning this puts a whole new perspective on how you view your own appearance and health problems. It is one of the most controversial areas in medicine that you have probably never heard about. The hard scientific evidence in black and white clearly demonstrates that crooked teeth is predominantly a nurture issue, our environment, how we now live, our soft modern lifestyles. That is yours, you the viewer, anyone watching this. When I mean ours, I mean your soft modern lifestyles, how your teeth are arranged, and to some degree, how your face is shaped. It can't get more personal than this. Now, this is a professional lecture, so it's aimed at people who want a good overview of the hard science, especially dentists, doctors, and health professionals, but also members of the lay public who want a deeper dive on this subject. The contents. We will cover the current situation and viewpoint in the profession, the history of the situation, our direct ancestors. We'll overview the scientific research. We'll look at epidemiology, how these problems have spread and where they started. Then we'll look at what the possible causative factors are. We'll move on to experiments of nature. Some of these images are distressing. We'll look at animal experiments. We'll look at the cohabitational effect and why this is important. We'll talk about prevention, and we'll have a note to what we're going to do about this and how you can help us. Now, what's the current status in the profession? Well, this is an image from Prof, the textbook Contemporary Orthodontics, the most popular textbook in orthodontics currently on the planet. When we look at this diagram, we'll notice that 60% are malocclusion, that's crooked teeth, of unknown causes. So openly admitted that the 60% of the population who have crooked teeth, malocclusion, they have that profession, my speciality, has no idea what causes the problem. Then they have 5%, they have known causes. But most of these are thumbsuckers, or people with clear aberrant pathology. Now that's environmental issues, not genetic issues. Less than 1% of these have syndromes, and some might have accidents, also environmental issues. Then we'll look at the 35% of normal occlusion. Now, it's important to remember that few of these people will have 32 teeth, or space for 32 teeth. That includes wisdom teeth, or even extra space, as all our ancestors seem to have not that long ago. So we could question that group of normals. When we think about causes of any disease, we talk about both genetic and environmental causes. Now, that has to be genetic influence. Without genes, you can't grow. But what about the environment? How prevalent are environmental causes? And that's what we want to question. So within the profession, it's considered that crooked teeth, malocclusion is multifactorial. But I would question that assertion, because if you don't know the cause, then how can you say that it is multifactorial? Now, a really important point, if we look back at the research of Corricini, looking at ancient skulls, he feels that less than 5% of people in the ancient world, our ancestors, had any form of crooked teeth. Then if we look at a research by Plato and Zachrison, they're suggesting in Scandinavia that only 5% of the modern population have straight teeth. So we've had a major shift in a relatively short space of time. And we've got to reflect on the fact that currently, at least, and in some areas more than 50% of the population are getting some form of orthodontic therapy. So this is important. Now, the old argument of genes versus environment. The evidence that genetics is causing malocclusion is poor, and it tends to be circumstantial. Whereas the evidence supporting the environmental, the nurture argument is vast. And the vast weight of quality research in peer-reviewed, respected peer-reviewed journals suggests that it's the environment. This research is just largely ignored. So how are we treating malocclusions currently today? Well, we're treating them largely as if they were genetic. We are taking out additional teeth. We are pushing teeth artificially into positions, and generally we're holding those teeth there forever. So we're treating it as if it were genetic. And my worry, this can cause bias. If you want an answer, you can get the answer, because that then supports the treatment we're providing currently. I've created an image here, and this image is the progression of malocclusion over the last 220,000 years. Now, if you notice the scale on the bottom, it's not a constant scale, it's a logarithmic scale. So it changes as it moves forwards in time, magnifying the most recent events. And I discuss here that throughout our evolutionary process, until we became civilized, I'm talking about 250 years ago or less, most people had relatively straight teeth from when they were born until they died. They also had space for all of their teeth, so they got their wisdom teeth in place because they had space for their wisdom teeth. Then, if we look at the other mammals, because we are one of 5,400 species of mammals, and what you'll notice is nearly all of the other mammals have more or less straight teeth from when they were born to when they die. They also have space for all of their teeth, so they're not short of space for teeth as we currently are. They don't have routine extractions of wisdom teeth as we currently do. Now, there are some exceptions to this rule. We see some malocclusion in domesticated cats and dogs, and in Britain at least we're seeing some malocclusion in feral foxes. But this is almost my argument in point. These are animals that have had a substantial change in their lifestyle. Now, we could also look at indigenous populations alive today. These tend to be marginalized groups, and we could question the lifestyle they now have. However, as a general rule, they tend to have fairly straight teeth. We consider someone walking off the African Serengeti with almost beautiful body posture, standing straight with their lips together, breathing through their noses. They have big, broad smiles with all 32 teeth in place. They never had orthodontics, they don't wear retainers, and as a general rule, they have excellent facial architecture, excellent bone structure of their face. Now, I've drawn two lines on this image, on this graph of malocclusion progression. The first line on this graph represents the Industrial Revolution. Humans have had three distinct features or phases in their pattern of lifestyle. We started as hunter-gatherers, we then transitioned into subsistence farmers, and at the time of the Industrial Revolution, we became specialists. Prior to this yellow line, you made most of your own food. Now, I remember as a student making some pretty terrible food, but I ate it. I didn't want to go out to the shops again, and clearly there was a cost implication, so I ate this food that I had made. However, I would never have paid for that stuff if I was in a restaurant, because it was not good. But when you make your own food, you're less of a discerning consumer. And come the Industrial Revolution, we became discerning consumers, and that put pressure on improving the quality and, let's say, the niceness of foods. And that was a marked change in our food intake. Now, there's another line I'll place here, and that's the black line. And this was the point when the orthodontic profession made their normative data. This is when we got X-ray equipment, we developed the X-rays, and so we started taking X-rays of people and combining that knowledge together to make what we refer to as the scientific data that guides the orthodontic profession, our normative data. It's very important to understand that if you've taken your normative data where you're trying to understand the problem at the very end or near the very end of a changing problem, that's going to upset the way you look at things. That's going to confound your real understanding of the problem. Now, What's important to note is that there's always been a little bit of malocclusion. There's always been some problems. That's natural. Not everyone's going to grow correctly. Some people are going to have accidents. That's just a shame. But for the majority of people, all the way through time immemorial, they had perfectly straight teeth. This is a very modern problem that has occurred evolutionarily in a blink of an eye. Now, when we look at the hard scientific evidence, I've just taken 2 papers, but as I said, the vast weight of quality research in peer-respected journals clearly demonstrate that malocclusion is of environmental origin. It's a nurture issue, not a nature issue. This science is just largely ignored. Now, I've chosen 2 papers here. I've chosen a paper from Corricini in 1990, where he compared 358 pairs of twins. So that is 716 individuals from 4 different nationalities. So this isn't a meta-analysis, he's combined the raw data. And what he's saying here, and I think the last line is most poignant, that hereditability estimates range from 0 to 40% and were erratic. So what he's saying here is that it's mainly the environment. Talking to proper genetic researchers, they're saying that unless you've got genetic variability of at least 60, if not 80%, it's going to be a disease of mainly the environment. I've also taken the work of Carol's in 2001 from Belgium, where she compared 33 monozygotic with 46 dizygotic pairs of twins. And when she sums up her research, she looks at the whole skull, and she's saying 72% of the vertical and 61% of the horizontal variables were under genetic influence. Now, many people have said to me that suggests that the genes are more important. But again, you've got to understand, you can't grow without genes. And if we reverse those numbers, we could say that 28% of the vertical and 39% of the horizontal factors are from the environment. When I create an image, these 2 boxes, what you can see is the gross difference between these 2 sizes. This 28% in the vertical and 39% in the horizontal is clearly a very large variation, and this could easily account for all the types of malocclusion we see, and some. So if the environment has such a large influence, and it can account for all the variations we see, then it probably is accounting for all the variations we see. Here's an image from Brian Palmer, a great researcher who had great ideas. It's an anecdotal image, but it's giving some illustration of the type of variation we see and how it's affecting the airway in particular. Then here's an image from you. And in this research, they're simply comparing old skulls, pre-industrial. These aren't ancient skulls, these are old pre-industrial skulls with modern skulls. Now, clearly these have been selected, so they can only be used as an illustration. But you can see from the sideways view, and you can see from this cross-section looking at the front, just how dramatically shapes have changed. And then we've got some research from Shen, looking at how malocclusion has changed in mainland China between 1988 and 2017. This is a systematic review and meta-analysis of other people's research. So their study reveals a dramatic increasing trend in the prevalence of malocclusion over time amongst the children in mainland China. So what we know of China, it's had a dramatic shift in lifestyle in a relatively short time period. So here it's quite evident when you look at the research that things are changing. They feel that this suggests the need for early recognition and the treatment of children in the deciduous, so young children in baby teeth. And finally, we go to the more recent research from Stanford, from the Jaws paper. To quote them, they say, "Some scholars, although they accept all or some of our narrative, still assert that part of the problem must be genetic or hereditary. They apparently do not realize that because every attribute of all living organisms must to some degree be traceable to their DNA or RNA, the statement is nonsensical. And nevertheless, some scientists continue to push partial blame for the epidemic towards genetic evolution, and they quote Punjab in 2008, while ignoring the etiology of jaw shrinkage and distortion, and they quote Powell 2009. So they feel that there is almost an exclusive environmental etiology to this problem. And we've got to remember that these are high-level leading geneticists such as Marcus Fieldman. And this is published in a leading scientific paper, which has an impact factor usually over 10, which is so far ahead of anything in the orthodontic world, where the American Journal of Orthodontics, the top orthodontic journal, rarely has an impact factor above 3. So we could look at what other genetic changes have occurred over the last 10,000 years, or a little more. We could consider lactose tolerance or alcohol dehydrogenase. These are important changes that have been noted in the genetic base, but these are relatively small changes. There was a reason for both of these changes, and they've taken quite a long time to occur, and they could easily be tracked through populations and understood scientifically. Epidemiology. This is the understanding of the spread of diseases. And following COVID, lots of people became epidemiological experts. This image shows the prevalence of sickle cell anemia in Africa and India. And you can see there are 3 distinct focal points where sickle cell anemia may have started, or maybe some people traveled between these 3 different points. When you have a genetic disease, you can do epidemiology on this scale, and it gives us great understanding of how diseases progressed, where they started, and an understanding of the nature of that disease. For malocclusion, for crooked teeth, we see this occurring wherever civilization rises. We see this whenever civilization rises. We see this in whichever population this civilization occurs, and often this occurs in complete isolation. So a civilization in South America develops in complete isolation, and they develop malocclusion. And that occurs in complete isolation to a civilization in China, or let's say a civilization in Europe. It seems that the relative level of the civilization is related to the relative level of malocclusion, crooked teeth. The classic example in Europe is that the more complex the graves, the more complex the items within the graves, the more complex the malocclusion, or the more pronounced the malocclusion we find. And also, there has been some evidence of a reversal of malocclusion and these problems following the collapse of civilization. So we've got to look at civilization as a strong contender from epidemiology. Now, we could review a lot of archaeology and anthropological textbooks, because from their perspective, malocclusion is a symptom of civilization. Within these professions, it's well understood, this isn't questioned, and they look with some perplexion on the research and the findings within orthodontics. Here is an image of normal occlusion. Now, this is an individual that probably had a relatively high level of wear on their teeth. One really important point to notice is how the front teeth have been worn away, because before you had knives, you cut things up by incising them with your incisors, doing this sort of thing. And another thing to notice is that spare space behind the wisdom teeth. There is considerable amount of spare teeth. Most of these individuals could have accommodated 36 or sometimes more teeth. And that's a stark change from what we have today. For the dentists, I would also ask, where are the canines? Because in this situation, the canines are a front tooth that are worn out of occlusion, which throws some interest on what we refer to as group function or canine guidance. Now, we don't know how much our ancestors were using knives, and I would imagine that this individual did have knives, but they're still having to use their front teeth for incising and possibly using the whole dentition for processing. Remember, before we had shops, before we had sketchers, if you wanted to have a nice pair of moccasins, you had some chewing to do. You had to process the leather and probably process those with your teeth. So our facial complex did more than just eating, it was also a processing unit. Now, I want to make a word for our sponsors. We are sponsored by the Mewing app. We all know that teeth sit in a balance between the lips and cheeks on the outside and the tongue on the inside. This is not in question, but it's vital for everyone to try and improve this balance. This can align your own teeth. It can make orthodontic treatments faster and more effective. It can minimize or prevent relapse after treatment. And possibly you could gain a total upswing in facial form, or at least prevent your face slowly dropping down over time as you age. This may have a significant impact on a number of other health issues within your face. And really, mewing is little more than saying stand up straight and shut your mouth. This is hardly a new idea. And these exercises in the Mewing app have been shown to reduce the measurements of sleep apnea by 50% in adults and 62% in children. We feel there are a lot of problems from faces that don't grow well, not just crooked teeth. And this here, the Mewing app, could be an answer to this. It's an easy answer. It's just exercises. You should try it, and that will help us to help you. Many of you will struggle as you lack tongue space or already have too serious a problem. And the best and possibly only way for you to get the help that you deserve is to help us get the spotlight of modern medical research to focus on this area. Our mission is to start debates on the cause and to work up, with the most immediate application being prevention. No kid should have malocclusion or any of the associated problems from poor facial development. Good facial bone structure is all of our birthright. Faces which grow well work well. And through simple public health messaging and simple cheap habits, we believe that we can make a real difference. Support us directly by going to the GoFundMe link below, or indirectly while helping yourself with the Mewing app, also linked below. All diseases are a mixture of genetic and environmental influences. So what are the possible environmental influences? Here is an image of someone with muscular dystrophy. You can see how his face has downswung. His face has lengthened, a little bit like a waxwork model that's got a little bit too close to the fire. A little bit like a bilateral stroke, as we will cover later. It's due to the muscles. There's no disease of the bones here, it's only due to the muscles. So simply having muscle weakness has dramatically changed the facial form of this individual. Here's an image of Stephen Hawking. He had a progressive muscle wasting disease. And you'll see here, as he's married for the first time, he's using a walking stick because the disease is starting to affect him. But I would argue that his facial form was relatively normal for a modern person. Now, here's an image of him some years later with his second wife, and you'll see how his face has changed shape dramatically. I would argue that this facial form is being influenced by how he holds his head on his headrest. His face has literally melted away. Now, he was fully grown in the first photograph. There has been no growth. All of this change has to be environmental, and it is almost certainly related to the disease he had. So here is a great change from the environment. Now we look at strokes. Here are two individuals who have had a unilateral facial stroke. Now, these are only the muscles of facial expression. These are only the surface muscles. This is not the power muscles. And yet, this is causing a significant change in facial form. One side of the face has lengthened dramatically. As I said earlier, from the individual with muscular dystrophy, where that individual had the same effect on both sides, these individuals have an effect on one side. They were fully grown, this can't have been the genes, this was an effect from the environment, and it's having a dramatic effect on their facial skeleton. Then we could look at masticatory effect, where is related to usage. the more you use your teeth, the more they're going to wear. And it's clear and apparent that our ancestors wearing their teeth a lot, so they were using their system. They were using this masticatory, this chewing system a great deal more than we use it now. We've gone from quite a tough, hard, low-calorie diet, we've gone across to a very soft, high-calorie diet. So we've reduced the amount we're using our jaws. Now, for example, you could buy a can of Coca-Cola that's going to provide you with about 140 calories. Now, growing children need somewhere between 1,200 and 2,000 calories. So this is 10% of the daily calorific intake for no masticatory effort. You don't have to chew to get that 10% of calories on board. I estimate that we're now using between 3 to 5% of the effort to gain our food that our ancestors gained. Now, the more you use your muscles, the bigger they get, and that will have a notable effect on the underlying structure, which is, I believe, what we're seeing. Another good illustration of these changes is the mode of breathing. We talk a lot about mouth breathers. If you're going to breathe through your mouth, by definition, your tongue has to be lowered, your mouth has to be open, and your jaw is lowered down. This is changing the overall posture. It's interesting, we debate if it's important where the air goes, and it probably has some level of importance. Here are some images of a boy. This was the son of a statistician who was working with my father, who brought his son to see my father, having worked on the statistics with him. This boy, soon after the first photograph, was given a gerbil that he kept in his bedroom. He then got a complete nasal obstruction. They worked out what was causing it afterwards, and the gerbil was removed. But the pattern of behaviour was then set in, and I believe this has had a profound influence on the way his face has grown. So clearly, the mode of breathing has an effect, whether that's direct or whether it's an influence by the posture of the tongue and hanging the mouth open. Now, we move on to experimental studies. Clearly, it's very difficult to experiment on humans. However, there was some fascinating research by Sten Linder-Aronson. He did some research where he took a group of individuals who couldn't breathe out their noses. They then had their adenoids and tonsils removed, and he then compared the group who then could breathe out their noses if they wanted to, against the group who still could no longer breathe out, still couldn't breathe out of their noses. And what he noticed was some very interesting changes in the way they grew. And there was a highly significant change in the way, or the difference between the two groups. But one of the interesting pieces of research, because like many researchers, he then took this one data set and analysed it from many different perspectives. And the really interesting thing I noticed was where he had looked at the angle of the front teeth, and the front teeth were set forwards like this, and then after the individuals could breathe out of their noses in that group, the incisors uprighted. Now, the incisors are a long way away from the airway, so it's results and information like this that really interest me. And the incisors upright, so the paper is called The Normalization of Incisal Position After Adenectomy, and that's fascinating. And in that paper, they noticed that in overall form, there was a 10mm more horizontal dimension in these individuals who then could breathe out of their noses than the individuals who continued not to be able to breathe out of their noses. So some really interesting pieces of research. However, the individual bone changes weren't much. It was only about 2mm, but when that added together to give the total horizontal, that was a greater change. That was interesting. Then we have the experimental studies of Harvold. Now, Harvold did two fascinating pieces of research that broke the mold. One was where he plugged monkeys' noses with, well, kind of stoppers, a little bit like the stopper you put into a test tube. He put them up monkeys' noses and he sutured them in position. Now, a lot of people have debated the whether or not that reflects what happens with individuals. It's very rare to get complete nasal obstruction. However, I feel he did a much more fundamental piece of research, and this is where he simply got an uncomfortable plastic wedge and he sutured it into the palate, onto the roof of the mouth. That made it uncomfortable for the monkeys to rest their tongue on the roof of the mouth. And they all then developed an open mouth posture. So they were still breathing through their noses, but now they have an open mouth posture. And what you see in this study was the dramatic change between the control animals and the experimental animals. There was no need for statistics because the control animals grew almost perfectly and the experimental animals were affected with a profound change in both the pattern and arrangement of the teeth, but also the whole facial skeleton changed. What we would refer to as they got both skeletal and dental malocclusions. So they had a really profound change only from a piece of plastic, uncomfortable piece of plastic, sutured into the roof of their mouths, preventing their tongues going on to the roof of their mouths. So that, I find, it's one of my favourite pieces of research, and Harvold is one of my favourite researchers. What we noticed here, all of the animals developed severe overbite, overjet and malocclusion of the class 2 type. Then, if a change in postural position affects the tooth extrusion and increase in facial height, then any factor lowering the postural position of the mandible would affect an increase in facial height. And in addition, monthly increases in face height were the same in the group of non-growing female animals as in the group of fast-growing males. So interestingly here, what he's saying is that the top jaw dropped down equally in the non-growing females as in the growing animals. That was interesting. And of course, another interesting piece of research done on this was Melvin Moss of the functional matrix hypothesis. And what he did was he took rats and removed the front legs. Yes, we do terrible things to animals. And having removed their front legs, these rats were forced to move around on their hind legs only and to lean their heads forward to see where they were. And what he noticed was a rearranging of the optic chiasma. Now, the optic chiasma is the nerve that runs behind the eyes between them. So you know you have a big nerve that goes from the eyes to the back of the brain. But you also have a nerve that crosses between the eyes. And that nerve runs in a chamber called the optic chiasma, and this reorientated its position. So here, this is interesting. This is a deep structure within the brain that's affected just by the animals trying to look over their snout at where they're walking. That was fascinating. Then we move on to the experiments of Hall. And what he did in 1983, he produced this research where he took a group of monkeys. Again, there was a control group and a non-control group. What he did in the control group was we took this muscle on the outside, the masseter muscle. He cut it down here, he lifted it up. Then he took out the temporal muscle on this side of the head. Where that comes in on what's called the coronoid process, the little bit of the jaw that sticks up, as marked, and he cut that off and sutured that onto the back of the mandible. So now the temporal muscle is stretched and attached to the back of the mandible. He then placed the masseter back down, but at the back over the top of where he'd placed the lump of the coronoid process, where he'd placed the temporal muscle. So both the big muscles of the jaw, the temporal muscle and the masseter muscle, have been moved so they're angled more horizontally, less vertically, and they've been stretched. And of course, what you see here in the bottom edge, so the bottom, just look at the very bottom edge of the mandible and how that mandible has raised right up. So the hatched line is the experimental monkeys and how they then developed. And it's completely shortened the face of these monkeys. And the interesting thing for me here is that when you take the mandible, the bottom jaw on its own, and compare the experimental with the non-experimental monkeys, there's very little change. The jaw hasn't changed very much, and yet there's been a really dramatic change in the overall facial form. And what seems to have occurred is that the small bones in this area of the face have been squeezed together and pushed forwards. It's almost a bit as if the mass of the tongue, this big lump of tongue that's residing within the jaws, has been squashed, and it's forced the small bones of the upper jaw, so you've got the maxillas, you've got the palatine bones, and all of this has been pushed up and forwards. And that's interesting because in many ways I think this reflects the opposite of what we're seeing with craniofacial dystrophy. This is the opposite of faces dropping down, downswinging. And science is really good when you can give examples of things going one way and the other way. And of course, the opposite of what Harvold noticed. So when Harvold was placing a piece of uncomfortable plastic on the roof of the mouth, he was getting the faces to downswing, very much like a class 2 pattern in humans. And here's Cole, and he's got exactly the opposite. So simply by either placing a plastic wedge on the roof of the mouth, you gain the downswing, and by tightening up the muscles and making a bit more horizontal, you gained an upswing in facial form. You know, I like science when you get both sides of an argument and you can demonstrate you can do either direction. There is a lot of evidence that suggests that malocclusion is an environmental problem. It's a nurture, not nature issue. The problem with most of this research is it doesn't fit with the modern thinking, so it tends to be ignored. It's all too easy to ignore problems. Clearly, we've oversimplified this. We haven't gone into all of the different research, but I'm going to make some generalizations. If we're looking at the general overall form of the head, I would say that this masticatory effort effect is clearly having a profound effect on how faces develop. Then we've got changes in the posture of both the tongue and the jaw, so we'll call that the mandibulolingual posture. These two factors seem to affect the general overall craniofacial form. Then we could look at changes in the actual arch form. We could look at changes in the position of the teeth, the general whether you've got a wide position of the teeth, or generally whether you fall into certain patterns of malocclusion. And I think that this is much more to do with the soft tissue balance. As we said, we've got the tongue on the inside, we've got the lips and cheeks on the outside, the teeth sit in a balance. And I feel this is being messed up by a certain number of things. I think that we're progressing from a suckle to a swallow. Incorrectly, we're getting the early introduction of very soft foods. Our ancestors didn't have any blenders. They didn't have soft, purified baby food. They had to introduce hard food to individuals. They had a long duration of breastfeeding, and that long duration of breastfeeding really encouraged the tongue to work effectively, function well. That's now no longer true, because either the period of breastfeeding has been reduced, or else we're introducing soft foods early, possibly before people are fully ready to swallow. And because they're not ready to swallow, and because the food is soft, babies are going into a modified swallowing pattern, and they're able to do that modified swallowing pattern because the food is soft. And then also we've got other interesting things like preterm intubation. And there's a lot of research showing that if you're born prematurely and you have a gastronasal tube, place or nasogastric tube or orogastric tube, this can affect the way your facial structure develops. And I think, in my view, this has a profound long-term effect because it changes the pattern in which you use your tongue. Babies should suckle, adults should swallow. And this progression is being interfered with by multiple things, from the early introduction of soft food to a lack of breastfeeding and other things that can get in the way. Okay, this is an example of an adenoidal face. This is an example of someone whose face has downswung. There's an increase in the vertical dimension, a reduction in the cross-sectional area. These adenoidal faces are noticed by their high palates, their short mandibles, and their generally long faces. Now, what's really interesting about this individual is that he had a twin. He had a twin brother that also presented with an adenoidal type face, and interestingly, a very, very similar malocclusion. Now, this is what dentists see. This is what the profession sees. So it's very easy to say, oh, Mike, you're wrong. Malocclusion must be genetic because I see it. I see these images. I see people who look the same as their parents, who look the same as their siblings. So how do we understand this? I've just given a very good argument that malocclusion and the influence on facial form is predominantly due to the environment. And yet, clearly, what's going on? Am I wrong? Or is there somehow we could put these two pieces of information together in a sensible way? Well, we have something called the cohabitational effect. And it says that persons living together exhibit resemblances, whether or not they are genetically related. Resemblance in stature, body mass index, types of diseases affecting you have been documented between parents and their adopted children, so no genetic relations, as well as between adopted and biologically unrelated siblings. So that makes sense. If you live in the same environment, you have similar effects from that similar environment. And we've got unconsidered effects as well that I've not talked about. We could talk about infantile mimicking. So the way that if you've been a father or a mother, you have this wonderful phase where your child looks up at you and mirrors your facial expression. You do a smile, they do a smile. And this is a pathway that we could be expressing similarities. This could be an unexplored environmental pathway, so we can't just disconsider these potential pathways. We could also think about language. I think that I can tell when someone's speaking French even when there's no sound. There's a certain way they use the lips, certain mannerisms, certain inflections of the facial form. So maybe there is something to that. And if there was something to that, that would suggest that certain groups of people have other environmental influences that we're just not looking at. Also, we notice that class 3 malocclusions are so much more common in China, in Japan, and some of these countries. Now, we know that they spend a lot of time sitting in very different, they sit cross-legged, they sit on the ground. Now, maybe that has an influence. We don't know. So before we start making these broad generalizations, we've got to try to consider all of the factors. And in summary, I think that if you've got the same genes and you live in the same environment, you're likely to get the same output. And if we look around ourselves and we think, oh, we're normal because, I wear a top like this, I'm in a room like this, I eat normal modern food, but is anything that I do now normal? My life is no longer like a hunter-gatherer. But if I think that I am normal, then I'm completely blind to this massive environmental change that we've had. And if I'm completely blind to that massive environmental change, then I'm not factoring that in. Then I'm not considering that massive environmental change. And that leaves you blind. That leaves you unable to see or appreciate the effects of this. Here is an image from Waddington. So Waddington talks about the epigenetic landscape. Now, I don't want to be caught up with this term epigenetics because I think it's one of the most abused terms that I know. But what he's saying is, here's a landscape, and he talks about over time and over a progression of time, depending on your landscape, the shape of your landscape, diseases can affect you in a different way. Now, I'm going to change this. Instead of time, I'm going to say that is a downswing in facial form. The progression here, the more downswung you are, the more you're affected. And then in this landscape, I'm going to place the different types of malocclusion. So I'm going to say the main line, the most likely avenue for this ball to roll would be class 1. A side alley from that would be the class 3, the sticky forward jaw. And then out to one side, you have the class 2s, either the class 2 division 1 or the class 2 division 2. If you're not an orthodontic or a medic, don't worry about those. Those are slightly different types of the same malocclusion. So what we'd say here is that the pattern, your epigenetic landscape may be inherited, but the actual problem, the stress causing to the problem, is the environment. And this is a very good way of putting these two observations together in a coherent theory that fits all the facts. And that's really important. We need models, we need answers that fit the facts, and they don't have to ignore research to gain an understanding or to fulfill your paradigm. So what's really interesting is this hypothesis fits all of the science that I have seen. And I'm reminded of Karl Popper's comment on the best fit hypothesis. And it's important when you reflect on these ideas, concepts, or have a general discussion that you don't have a bias. You don't come here wanting to prove a genetic etiology because you are tied to a treatment system that's suggesting it's genetic. And it's very important we do that and we reflect on that. And unfortunately, I'm simply the bringer of difficult answers. Now, one example that has been used widely in the orthodontic literature are the Habsburgs. These were a family that, I think the quote from one of the Habsburgs is that they have acquired more land and gained more territory through marriage than by war. And this was a lineage of Habsburgs where nearly all of them had arranged marriages, and over time they became more and more inbred. But one of the defining features of the Habsburgs was this class 3 arrangement, this sticking forward jaw. But as you will notice from this individual, he has no maxilla. He's clearly downswung. And could we draw any conclusions about his lifestyle? Did he have a hard diet? Did he have a hard lifestyle? Well, that's quite unlikely. There's also the distinct possibility that this inbreeding led to some disease. One of the Dutch members of the Habsburg family was unable to procreate because he was not well. And I think in my profession, my speciality, I'm not here to be critical, although science is supposed to be critical, that's the nature of science. I'm just asking us as a profession that we need to look further. We need to understand the cause of the problem that we're treating. I think that goes without saying. And if you're going to rely or use this family as an example of a genetic influence, I think we've got a question if we've lost our way. You can't use the Habsburgs. Anyone using the Habsburgs doesn't understand proper science. And possibly this is a sign that the genetic argument is having to scrape the barrel slightly. Now, here's an individual that has gained good growth over their lifestyle. This was an early photograph from many years ago when some of these tribes were being first contacted and first engaged with. This person's living a lifestyle very similar to hunter-gatherers they had lived for hundreds of thousands of years. Now, I could make an argument that even someone who has weapons is not actually living in a totally ancestral way. Well, not so much how they evolved to live. And we could ask the questions of how rapid was the introduction of these weapons and knives or flintstones or whatever they were using. Because you could make the argument that these technologies were being introduced faster than evolution could cope with. Now, another good example I make when I'm talking about genetics is fat families. Families that are overweight. Because I see families that are overweight. I see family where the children, the parents, they're all overweight. Now, it does seem to be that certain families are predisposed to putting on weight, to becoming obese. But still, the actual cause is the environment. I mean, you see the whole family is overweight and the cat's overweight. Well, the cat is not related. And that's general environmental influence that we see more and more today in a modern society. Now, why is this important? Well, we say if you don't know the cause of something, then you don't really understand the disease. And that's really profound. And it's really important because until you start looking at malocclusion, faces that aren't growing properly, from this angle, you are clouded in your thinking, okay? Of course, we've got a huge amount of relapse following orthodontic therapy. It's endemic. Now people who have orthodontic therapy are asked to wear retainers for the rest of their lives. Now, why? What can we do about this relapse? How can we help people get away from needing their retainers? Or again, how can we expedite orthodontic treatment? Because understanding the cause can really be beneficial. But of course, the most important thing of all, we could consider prevention. If we understand what's causing a problem, if we understand how that process is occurring, then we can consider prevention. Because I believe that simple public health messages like eating with your lips together, a hard food choice, less junk food, standing up straight and shutting your mouth, breathing through your nose, or baby-led weaning and extended periods of breastfeeding could all be really, really helpful at preventing these problems. Prevention has to be the answer, particularly when it's simple, it's easy, and none of these recommendations are really in question as whether they're desirable. So why can't we consider putting these out, making parents aware of this? Now, all I want is the continuation of the normal scientific process in orthodontics. So I just want us to follow the scientific process. So in 2009, I wrote this article, The Black Swan, where I challenged my profession for a debate on the etiology of malocclusion, the cause of crooked teeth. And following this, I ran a 6-year letter writing campaign, and I wrote to the General Dental Council, the British Orthodontic Society, I wrote to the Minister of Health, the Quango that was at the time above the General Dental Council, it's changed now. I wrote to the All-Party Dental Committee, the Department of Health, I wrote to the everyone, absolutely everyone. I wrote to all of them until they told me where to go. I pushed it, okay? So I effectively exhausted all possible normal, sensible avenues of inquiry, asking a very sensible question. And of course, nothing happened. No one wanted to engage in this. Now, why is this? And then what should we do about this? Well, my worry is that this subject's being brushed under the carpet because people don't see it as being important. And yet I think when you start opening that up, it's amazing where this will go. So, what can we do about it? Well, we need to get working to try and gain a debate on the etiology. That's the minimum we need. Or should I say an acknowledgement, some type of engagement we need. We need to talk. We need to talk about this issue. We've got all these people wearing retainers. We've got many people with some really serious problems. You know, even if you are not someone in a significant suboptimal situation who needs this help, I think you might be aware of this, because unless you have 32 teeth in your head, your growth has not gone correctly. And you may have other problems, because simply put, if this structure is not the right shape, it's unlikely to work properly. And things like jaw joint problems, things like sleep apnea, things like forward head posture, we all think these are related. So sometimes when you open Pandora's box, as I have, and you follow the scientific process, you get to good answers. So we want to get the spotlight of modern medical research to focus on this area. For many of you who lack tongue space, this is your best option of getting answers. I would love you to help us. I'd love you to volunteer. Can you donate directly to the GoFundMe below, or go and get the Mewing app and help yourself while you're helping us? The minimum of what you should do is to tell others, possibly by sharing this video. Make it aware. Make the world aware that we have a problem, we don't understand something, and we need to gain that understanding, because that's a scientific process. That's what we need to do. That's what I need to do as a scientist, and I call upon you to help me. Thank you very much.